You're lying in a bed in 1347, somewhere in what will eventually become France, and you've got a fever. Not just any fever, the kind that makes you hallucinate and sweat through 3 layers of wool blankets. Your family is huddled in the corner, praying to 17 different saints, which honestly should have been your first clue that modern medicine is still about 600 years away. The door creaks open. In walks the doctor, and I want you to really picture this guy. He's wearing a robe that hasn't been washed since the Crusades. He's got a pointy hat that makes him look like a discount wizard, and he's carrying what can only be described as a medieval tackle box full of horrors. He takes one look at you, strokes his beard thoughtfully, and says the words that will seal your fate. We must balance your humors. Congratulations. You're about to experience medieval medicine, and brother, you're not going to enjoy it. See, here's the thing about doctors in the Middle Ages. They were absolutely 100% convinced they knew what they were doing. They had textbooks, they had theories, they had prestigious universities where they learned their craft. They just happened to be catastrophically, hilariously wrong about almost everything. And I mean everything. These guys looked at the human body, this incredibly complex biological machine, and decided it was basically just a sack full of liquids that needed to be kept in perfect balance. They saw disease and thought, you know what would fix this? Letting some blood out. They encountered mental illness and concluded the best course of action was to drill a hole in someone's skull to let the demons escape. Today, we're going to dive into the absolute chaos that was medieval medicine. We're talking bloodletting, urine tasting, trepanation, and medical theories. So bonkers, they make astrology look like peer-reviewed science. We're going to explore how these medieval doctors, who genuinely believed they were helping, managed to kill more people than they saved, all while charging premium prices for the privilege. This is the story of medicine before anyone understood germs, anatomy, or basic hygiene. This is the era when your doctor might prescribe you a dead pigeon strapped to your head, and everyone would just nod like that made perfect sense. Welcome to medieval medicine. Try not to get sick. Part 1. The theory of humors, or how medieval doctors explained literally everything. Chapter 1. The 4 humors. Medieval medicine's biggest mistake. All right, before we get into the truly horrifying treatments, we need to understand the foundation of medieval medical theory. Because these doctors weren't just making stuff up randomly. They were following a very specific, very wrong system that had been around for over 1,000 years. It all goes back to ancient Greece, specifically to a guy named Hippocrates, the do no harm guy, which is ironic because his theories would lead to centuries of very much doing harm. Hippocrates, and later his homeboy Galen, came up with this idea that the human body contained 4 essential fluids, or humors: blood, phlegm, yellow bile, and black bile. According to their theory, when these 4 humors were perfectly balanced, you were healthy. When they got out of whack, you got sick. Each humor was associated with specific qualities: blood, hot and wet; phlegm, cold and wet; yellow bile, hot and dry; black bile, cold and dry. And here's where it gets wild. They also believed these humors corresponded to the 4 elements: earth, air, fire, water, the 4 seasons, and even personality types. If you had too much blood, you were sanguine, cheerful and optimistic. Too much phlegm made you phlegmatic, calm and unemotional. Excess yellow bile made you choleric, angry and irritable. And too much black bile made you melancholic, sad and depressed. It was this beautiful, symmetrical, completely fabricated system that explained everything about health, personality, and disease. And medieval doctors ate it up like it was gospel truth. Now you might be thinking, okay, but surely they eventually figured out this was nonsense, right? Wrong. This theory dominated medicine for literally 1,500 years. 1,500 years. From ancient Greece all the way through the Renaissance, doctors were out here balancing humors like it was their job. Which, to be fair, it was. The problem? None of these humors actually exist. Black bile isn't a thing. The human body doesn't work like a chemistry set where you just need to add a little more phlegm to balance out excess blood. But medieval doctors didn't know that, so they built their entire medical practice around adjusting these imaginary fluids. Chapter 2. Diagnosis by vibes, and also pee. So you're a medieval doctor, and a patient comes to you complaining of illness. How do you diagnose them? Well, first you ask them about their symptoms. Pretty standard, but then you start getting into the weird stuff. You check their pulse, but not like a modern doctor. Medieval doctors believed different types of pulses revealed different imbalances. There was the full pulse, the empty pulse, the rapid pulse, the slow pulse, and about 50 other variations that supposedly told you exactly which humor was out of balance. Then you'd examine their tongue, their eyes, their skin color. You'd ask about their diet, their mood, their dreams. You'd consider their age, their profession, the season, the weather, the position of the stars, because obviously planetary alignment affects your humors. But the real diagnostic superstar, urine. Medieval doctors were obsessed with pee. They had elaborate charts showing 20 different colors and consistencies of urine and what each one meant. They would hold up a flask of your pee to the light, swirl it around like a fine wine, and make pronouncements about your health based on its clarity, color, smell, and even taste. Yes, taste. Some doctors would actually taste the patient's urine. Notes of sugar with a hint of kidney failure. Definitely an excess of yellow bile. They had special urine flasks called matulas that were designed specifically for this purpose. There are medieval paintings of doctors solemnly examining urine while patients wait anxiously for the diagnosis, which is just incredible when you think about it. And the best part? A lot of medieval doctors practiced uroscopy without even seeing the patient. You could send a servant with a flask of your pee to the doctor, and he'd diagnose you sight unseen based entirely on your urine. Tell Lord William his phlegm is definitely excessive. I can tell by his pee's cloudiness. He should avoid cold foods and maybe get bled on Thursday. This actually led to some hilarious fraud cases where people would send animal urine or even just dirty water to test whether the doctor was full of it. Spoiler alert, they usually were. Chapter 3. Bloodletting. The solution to everything. Now we get to the big one. The treatment that defined medieval medicine more than any other, bloodletting. If you walked into a medieval doctor's office with literally any complaint, headache, fever, broken leg, depression, indigestion, whatever, there was like a 70% chance the doctor would say, "You know what you need? We need to let some of that bad blood out." The logic went like this: you're sick because your humors are imbalanced. Most of the time, they decided you had too much blood, because blood was considered the dominant humor. So the solution was simple. Remove the excess blood, restore balance, cure the disease. Easy, except for the part where this didn't work and actually made people worse. But let's talk about the methods, because medieval doctors had options when it came to getting blood out of your body. Method 1. Venesection, the classic. This was your standard bloodletting. The doctor would tie a tourniquet around your arm, locate a vein, and cut it open with a special knife called a fleam. Then they'd just let you bleed into a bowl until they decided you'd lost enough blood. How much was enough? Great question. There was no standardized amount. Some doctors would take a few ounces. Others would drain you until you passed out, figuring that's when the balance was restored. They had elaborate charts showing which vein to cut based on what ailment you had. Headache? Cut the vein in your temple. Stomach problems? The vein in your foot. Liver issues? The one in your right arm. It was like a terrible bloody game of operation. Method 2. Leeches, nature's bloodsuckers. If cutting someone open seemed too aggressive, or if the patient was a child or someone delicate, doctors would use leeches instead. They'd place these slimy little vampires on the affected area, and let them suck away. Each leech could drink about a teaspoon of blood, and doctors would use anywhere from 1 to dozens of leeches, depending on how much blood they wanted to remove. The benefit of leeches was that they were supposedly more precise and gentle than cutting. The downside was that you now had a bunch of blood-sucking worms attached to your body, which, isn't ideal. Leeches were so popular that there were professional leech collectors who would wade into ponds and marshes to catch them. They'd sell them to doctors and apothecaries, and some doctors kept their own leech tanks. It was a whole industry built around medical worms. Method 3, cupping, the fancy option. This was for the wealthy patients who wanted their bloodletting to be a bit more sophisticated. The doctor would make small cuts on your skin, then place heated glass cups over the cuts. As the air in the cups cooled, it created suction, pulling blood out of the cuts and into the cups. It was basically like bloodletting meets spa treatment. Some people genuinely thought it felt good, probably because the suction created a weird tingly sensation that distracted from the fact that they were being drained like a car's oil tank. The problem with all of this, here's the thing, bloodletting sometimes seemed to work, which is why it persisted for so long. If you had a fever and got bled, sometimes your fever would go down, but not because bloodletting cured you, because losing blood drops your blood pressure and makes you cold, which can temporarily reduce a fever. You weren't healed, you were just in shock. If you had high blood pressure, though they didn't know that condition existed, bloodletting might actually make you feel a bit better temporarily by lowering it. But again, not because the theory of humors was correct, just because you were literally reducing the volume of blood in your body. The real problem was that bloodletting weakened patients who needed their strength to fight disease. It made infections worse by reducing the body's ability to fight them. It caused anemia, which led to even more health problems. And in cases where the phlegm or leeches weren't clean, which was most of the time, because germ theory wouldn't be discovered for another few centuries, it could introduce new infections. But medieval doctors saw the occasional success and ignored all the deaths, because confirmation bias is a hell of a drug. Chapter 4. Purging, because what goes in must come out, violently. If bloodletting was about removing bad blood, purging was about removing bad everything else. Medieval doctors were deeply concerned with your body's ability to expel waste. They believed that diseases could be caused by impurities building up inside you. So naturally, the solution was to force everything out through any available exit. Vomiting, the upward purge. Doctors had entire arsenals of substances designed to make you vomit. We're talking emetics made from herbs, minerals, and some truly questionable ingredients. One popular choice was antimony, a toxic metal that would cause violent vomiting. Another was white hellebore, a plant so poisonous that it could literally kill you if you got the dose wrong. The doctor would give you this stuff. You'd spend the next several hours puking your guts out, and then the doctor would nod approvingly and say, "Excellent, we're expelling the corrupted humors. Never mind that you now felt 10 times worse than before." That was just part of the healing process, apparently. Laxatives, the downward purge. If making you vomit wasn't enough, or if they wanted to hit you from both ends for maximum efficiency, they'd give you powerful laxatives. Medieval laxatives were not gentle. We're not talking about taking a couple of Tums here. These were industrial-strength bowel destroyers, made from things like senna, aloes, and rhubarb in doses that would have you camping out in the privy for days. Some doctors believed that the more violently and frequently you purged, the better the treatment was working, so they'd keep giving you higher and higher doses until you were essentially incapacitated by diarrhea. Fun fact, King Charles II of England, who lived in the 17th century, so technically post-medieval, but the medical practices were similar, was given a laxative so strong that he had 14 bowel movements in one day. He did not survive his doctor's care. Sweating, the all-over purge. Medieval doctors also loved a good sweat. The theory was that sweating expelled bad humors through your skin. They'd wrap you in blankets, give you hot drinks, pile more blankets on, maybe stick you in a room with a fire going, and basically try to turn you into a human sauna until you were sweating bullets. Sometimes they'd combine this with other treatments. Bloodletting plus purging plus sweating was like the medieval medical trifecta. If you survived all three, you were either cured or too exhausted to complain anymore. Chapter 5. Cauterization. When in doubt, burn it. Here's a fun medieval medical principle. If you can't cure it with bloodletting or purging, maybe try burning it. Cauterization was the practice of applying red-hot irons to the body to treat various ailments. And when I say various ailments, I mean pretty much anything. Got a wound that won't heal? Burn it to seal it shut. Have a tumor? Burn it off. Chronic pain in your joints? Burn the area to create a counter-irritation that would supposedly distract from the original pain. This is the medical equivalent of hitting your thumb with a hammer to forget about your stubbed toe. Internal problems. Burn the skin over the affected organ to draw out the disease. The logic was that heat could destroy corrupted humors and purify the flesh. Plus, in cases of wounds, cauterization actually did help prevent bleeding and could kill surface bacteria. Though they didn't know why it worked, they just knew it sometimes did. But the application was brutal. Doctors had sets of cautery irons in different shapes and sizes. They'd heat them in a fire until they glowed red hot, then press them against the patient's skin with no anesthesia beyond maybe some wine or herbs that barely took the edge off. Imagine the smell. Imagine the screaming. Imagine being the doctor who did this day in and day out and convinced yourself you were helping. Some doctors specialized in cauterization and had elaborate theories about exactly where to burn based on different diseases. There were cautery charts showing dozens of points on the body and what condition each point treated. It was like acupuncture, except instead of needles, they used burning metal, and instead of based on centuries of refined technique, it was based on complete nonsense. Part 2. The practitioners. Or, who were these people? And why did anyone trust them? Chapter 6. The medical hierarchy. Not all doctors were created equal. Here's something important to understand about medieval medicine. Doctor wasn't just one job. There was actually a whole hierarchy of medical practitioners, and where you fell in that hierarchy determined what you were allowed to do and who you were allowed to treat. At the top, physicians. These were the fancy boys, university-educated, Latin-speaking, theory-obsessed scholars who rarely got their hands dirty with actual patient care. To become a physician, you'd spend years at a university studying the works of Galen, Hippocrates, and Avicenna. You'd learn about the humors, the planets, the proper balance of hot and cold, wet and dry. You'd memorize elaborate theories about disease causation. What you wouldn't learn, anatomy, really. Dissection was rare and often illegal. Surgery, that was beneath a physician's dignity. Actual practical medical skills? Not really necessary when you were mostly going to diagnose by looking at pee. Physicians wore long robes, often in red or purple to signify their status. They consulted with wealthy patients, prescribed treatments, which other people would carry out, and charged enormous fees. The irony is that physicians, despite their education and prestige, were often the least useful medical practitioners. They were so married to their incorrect theories that they wouldn't adapt to what actually worked. They looked down on practical hands-on medicine as crude and unscholarly. In the middle, surgeons and barber surgeons. Surgeons were considered tradesmen, not scholars. They learned by apprenticeship, not university. And they actually did stuff. Amputations, treating wounds, setting bones, removing bladder stones, that kind of thing. The catch? Surgery was dangerous as hell in the Middle Ages. No anesthesia, no sterilization, no antibiotics. The survival rate for major surgery was maybe 50-50 on a good day. But here's where it gets weird. In many parts of medieval Europe, regular surgeons and barber surgeons were two different things, with barber surgeons being lower in the hierarchy. Barber surgeons were literally barbers who also did medical procedures. You'd go in for a haircut and a shave, and while you were there, maybe get a tooth pulled or have a boil lanced. The red and white barber pole you still see today, that comes from this era. The red represented blood, the white represented bandages, and the pole itself represented the stick patients would grip during bloodletting to make their veins pop. Barber surgeons did bloodletting, pulled teeth, set fractures, and treated wounds. They were often more affordable than physicians or regular surgeons, which made them popular with common folk. The really bizarre part, in some places, barber surgeons and regular surgeons were in competition and would sometimes get into literal street fights over who had the right to perform certain procedures. Medieval medical turf wars. You love to see it. At the bottom, apothecaries and herbalists. Apothecaries were basically medieval pharmacists. They prepared and sold medicines, usually based on recipes that had been passed down or prescribed by physicians. They had shops full of herbs, minerals, animal parts, and various substances that ranged from genuinely helpful to completely useless to actively poisonous. Want some willow bark for pain relief? Which actually works because it contains salicin, a precursor to aspirin. The apothecaries got you. Need some powdered unicorn horn to cure poison? Which doesn't work because unicorns don't exist, and they were probably selling you ground up narwhal tusk or just regular animal horn. The apothecary will sell you that too at premium prices. Herbalists were even lower on the social ladder. These were often women who had knowledge of local plants and traditional remedies. They were affordable and accessible, which made them popular with the poor, but they were also frequently accused of witchcraft because apparently knowing which herbs helped with childbirth made you suspicious. And then there were the quacks. Beyond the legitimate, if misguided, medical hierarchy, there was a whole ecosystem of traveling charlatans, self-proclaimed healers, and con artists. These people would roll into town, promising miracle cures, selling tonics made of who knows what, performing operations that were really just theatrical shows, and then disappearing before anyone realized they'd been scammed. Some sold Theriac, a supposed cure-all that allegedly contained dozens of ingredients, including viper flesh. Some sold Mummia, which was literally ground-up Egyptian mummies that people consumed because they thought it had healing properties. Some sold holy relics that would definitely cure you if you prayed hard enough while touching them. The wild thing? Sometimes these quacks were more successful than legitimate doctors because at least they weren't actively bleeding their patients to death. Chapter 7. Medical Education, or How to Spend Years Learning the Wrong Things. So you want to be a medieval physician, buckle up, because you're about to spend the better part of a decade learning an elaborate system of confidently incorrect information. Step 1. Get into university. First, you needed to be male and from a family wealthy enough to pay for university. Women were almost entirely excluded from formal medical education, though some still practice medicine, especially as midwives or herbalists. The major medical universities in the Middle Ages were in places like Salerno, Bologna, Paris, Montpellier, and Oxford. These were prestigious institutions where the future elite of the medical profession would be trained. Step 2. Study the classics in Latin. Your entire education would be based on texts, primarily. The works of Galen, a Roman physician from the 2nd century, the Hippocratic Corpus, ancient Greek medical texts, the Canon of Medicine by Avicenna, an 11th century Persian physician, various Arabic medical texts that had been translated into Latin. You'd spend years memorizing these works, not questioning them, not testing them, just absorbing them as absolute truth. The problem? Galen had based many of his anatomical writings on dissecting animals, not humans, so his descriptions were often hilariously wrong. But for over 1,000 years, suggesting Galen might be incorrect was basically academic heresy. Step 3. Learn astrology. Yes, really. A huge part of medical education was astrology. Medieval doctors genuinely believed that the positions of planets and stars affected health, and that treatments should be timed according to astrological charts. Each zodiac sign governed different parts of the body. Aries, head and face. Taurus, neck and throat. Gemini, arms and lungs. And so on. Doctors would consult astrological charts before performing treatments. Bloodletting when Mars was in a certain position. Bad idea. Surgery during a lunar eclipse. Absolutely not. There were entire medical textbooks dedicated to astrological medicine. This wasn't a fringe belief. It was mainstream medical practice. Step 4. Maybe see a dissection, if you're lucky. In the later Middle Ages, some universities started performing occasional human dissections for educational purposes. But these were rare events, maybe once a year if you were lucky. And even when they happened, they were weird. The professor wouldn't do the dissecting himself. That was beneath his dignity. A barber surgeon would do the actual cutting, while the professor sat in a chair reading from Galen's texts, pointing at body parts. If what the barber surgeon uncovered didn't match what Galen had written, they assumed the body was somehow abnormal. Not that Galen might be wrong. Step 5. Graduate and start killing people. With confidence. After all this education, you'd graduate with impressive credentials, an encyclopedic knowledge of humoral theory, and absolutely no practical experience actually helping sick people. But you could charge high fees, wear fancy robes, speak in Latin to impress the peasants, and consult on the care of nobles and royalty. The fact that your treatments were based on fundamentally flawed theories and often made patients worse. That was just medicine, baby. Part 3. The treatments, or a comprehensive guide to medieval medical torture. Chapter 8. Trepanation, drilling holes in heads. Since forever. All right, let's talk about one of the most metal medical procedures in history, trepanation. That's the practice of drilling, cutting, or scraping a hole into someone's skull while they're still alive. And before you ask, yes, people survived this. Archaeologists have found medieval skulls with holes that show clear signs of healing, meaning the person lived for years after someone took a drill to their head. How they managed this without anesthesia, antibiotics, or any understanding of sterile technique is honestly kind of amazing and horrifying in equal measure. So why would anyone think drilling holes in heads was a good idea? The medieval reasoning went something like this. If you've got severe headaches, seizures, mental illness, or head trauma, there's clearly something bad trapped inside your skull. Maybe it's corrupted humors. Maybe it's evil spirits. Maybe it's just pressure that needs to be released. Solution? Make a hole and let it out. The procedure. Imagine you're the patient. You've got chronic headaches that won't quit, and you've tried everything else. Bloodletting, purging, prayer, wearing a dead mole around your neck. Yes, that was actually recommended for headaches. Nothing's worked. So you go to a surgeon who specializes in trepanation. He's got a collection of tools that look like they belong in a torture dungeon. Drills, saws, scrapers, and chisels. First, he shaves a patch of your head. Then, maybe he gives you some wine or some herbs that are supposed to dull the pain, but mostly just make you slightly drunk and still completely aware of what's happening. Then he starts cutting. He might use a trepanning, a drill-like device that bores a circular hole. Or he might use a trephine, basically a circular saw. Or, if he's old school, he might just use a regular drill and make multiple holes in a circle, then pop out the piece of bone in the middle. You're awake for all of this. You can feel the pressure, hear the scraping and crunching sounds, feel the blood running down your face. The pain is unimaginable. If you're lucky and the surgeon is skilled, he doesn't go too deep and damage your brain. If you're unlucky, well, you probably die on the table or shortly after from infection or brain damage. But let's say you survive. The surgeon bandages up your head, tells you to rest, and charges your family an enormous fee. You've now got a permanent hole in your skull that may or may not have helped your headaches. Did it ever work? Here's the weird thing. Occasionally, trepanation might have actually helped, though not for the reasons medieval doctors thought. If you had a skull fracture with bone fragments pressing on your brain, removing those fragments would relieve pressure and could save your life. If you had a subdural hematoma, blood pooled between your skull and brain, releasing that pressure might help. But medieval doctors didn't understand this. They couldn't see inside the skull to know what was going on. They were just drilling holes and hoping for the best. And for every case where it accidentally helped, there were probably dozens where it caused catastrophic infections, brain damage, or death. Chapter 9. The Plague Years. When medicine completely failed. We need to talk about the Black Death, because nothing exposes the absolute inadequacy of medieval medicine, quite like a pandemic that killed a third of Europe's population. The plague hit Europe in 1347, and medieval doctors were completely, utterly unprepared. They had no idea what caused it. Spoiler bacteria carried by fleas on rats. They had no idea how it spread. Spoiler through those fleas and also pneumonic transmission between people. And they had no effective treatments. But did that stop them from trying? Absolutely not. Plague, cures, and preventions. Medieval doctors threw everything at the plague, and I mean everything. Here's a sampling of the absolutely bonkers things they tried. Bloodletting, because of course, you've got a disease that's killing you by the thousands. Better drain some blood to balance those humors. Spoiler alert, making plague patients weaker by bleeding them did not help. Lancing the buboes. The plague caused painful swellings called buboes in the lymph nodes. Medieval surgeons would cut these open to drain the pus, which sounds reasonable, except they did it with unsterilized tools and often introduced new infections. Some patients died faster from the surgery than they would have from the plague. Aromatic protection. Doctors believed the plague spread through miasma, bad air carrying the disease, so they recommended carrying flowers, herbs, and aromatic substances to ward off the bad air. This is where the plague doctor outfit comes from, that iconic bird mask costume. The beak was stuffed with herbs, spices, and flowers to filter the supposedly corrupted air. Did it work? No. Did it look terrifying? Absolutely. Imagine being sick with plague and a guy dressed like a demonic bird walks into your room. That's not helping anyone's recovery. Drinking mercury. Some doctors prescribed drinking liquid mercury or applying it to the skin. Mercury is, of course, extremely toxic. So now you had plague and mercury poisoning. Great combo. Sitting next to a fire. The theory was that heat would drive out the disease, so they'd tell plague patients to sit as close to a fire as possible in summer, while they had a raging fever. This definitely killed people faster. The vinegar treatment. Some doctors had patients drink vinegar or bathe in it, believing it would purify the blood. It didn't help with plague, but at least it wasn't actively poisonous like the mercury. Flagellation. Some people, in their desperation, turned to self-flagellation, whipping themselves to atone for sins they believed had caused God to send the plague. This obviously didn't cure plague, but it did spread the disease faster as groups of flagellants traveled from town to town, gathering crowds and spreading bacteria. Eliminating bad air from rooms, doctors would seal up sick rooms and burn aromatic substances inside to purify the air. This mostly just made the rooms smoky and harder to breathe in, which definitely didn't help people struggling with pneumonic plague. The Jewish persecution. In one of the darkest chapters of plague history, some communities blamed Jewish people for the disease, claiming they'd poisoned wells. This led to horrific massacres of Jewish communities across Europe. Medieval doctors sometimes contributed to this by spreading theories about how the plague was caused by deliberate poisoning rather than natural causes. It was medicine being used to justify genocide, which is about as evil as it gets. The few things that actually helped. Ironically, some of the folk wisdom that developed during the plague actually worked, even though people didn't understand why. Quarantine. Some cities started isolating sick people and requiring ships to wait 40 days before unloading, which is where we get the word quarantine, from Italian 40 giorni, 40 days. This actually did slow the spread, though doctors at the time didn't understand the mechanism. Fleeing to the countryside, rich people who fled crowded cities for rural areas often survived because they were getting away from the rat populations that carried the plague. They thought they were escaping bad air. They were actually escaping disease vectors. Chapter 10, Women's Health, where medieval medicine got extra weird. Medieval medicine was bad for everyone, but it was especially bad for women. The combination of fundamental anatomical ignorance and deeply misogynistic attitudes created a perfect storm of terrible medical care. Pregnancy and childbirth. Let's start with the fact that most medieval doctors were men who had never seen childbirth and weren't allowed in delivery rooms anyway. Women's reproductive health was handled primarily by midwives, women who learned through apprenticeship and experience. The good news? Experienced midwives were often quite skilled and had practical knowledge passed down through generations. The bad news? They had no formal medical training, no understanding of germ theory, and limited tools. Childbirth in the Middle Ages was genuinely one of the most dangerous things a woman could experience. Mortality rates for both mothers and babies were horrific by modern standards. Medieval obstetric, wisdom. Doctors who wrote about pregnancy and childbirth without ever attending one came up with some truly special ideas. The wandering womb theory. Some medieval doctors, following ancient Greek ideas, believed that the uterus could literally move around inside a woman's body. If a woman had abdominal pain, hysteria, or breathing problems, they'd diagnose a wandering womb that had migrated to the wrong location. Treatment? Try to lure it back to its proper position with sweet smells near the vagina and foul smells near the nose and mouth. I wish I was making this up. Maternal impression. Medieval doctors believed that what a pregnant woman saw or experienced could physically mark her baby. If a pregnant woman saw a rabbit, her baby might be born with a hair lip. If she saw a fire, the baby might have a red birthmark. This led to pregnant women being advised to avoid looking at anything ugly, scary, or unusual, and to only look at beautiful things, as if pregnant women didn't have enough to worry about. Gender determination. Medieval doctors had elaborate and completely wrong theories about what determined a baby's sex and how to influence it. Some claimed that babies conceived when the wind was from the north would be boys, while southern winds produced girls. Others said that if you wanted a boy, you should tie off the left testicle during conception. Please don't try this. Some claimed you could tell the baby's gender by which breast was fuller, or which direction a ring swung when suspended over the pregnant belly. None of this worked, obviously, but it didn't stop doctors from confidently offering advice. Menstruation. Medieval medicine had absolutely wild ideas about periods. Some doctors believed menstrual blood was toxic waste that the body needed to expel. Others thought it had magical properties. There were beliefs that looking at menstrual blood could dull mirrors. Menstruating women could kill plants just by walking near them. Menstrual blood could cure certain diseases if used in medicines. Women were more susceptible to demonic possession during menstruation treatments, for period problems were equally bizarre. Painful periods. Try bloodletting from your foot. Irregular periods. Take this mixture of herbs that may or may not be toxic. No periods. Clearly your womb has wandered off again. Time for the smell treatment. Infertility. When couples couldn't conceive, it was almost always blamed on the woman, because of course it was. Treatments for female infertility included fumigation of the vagina with various aromatic substances, pessaries, vaginal suppositories, made from herbs, animal parts, and sometimes toxic substances. Bloodletting to restore balance. Prayers and pilgrimages to fertility saints. Wearing amulets made from rabbit testicles or other fertile animal parts. If none of this worked, doctors might eventually consider that maybe, possibly, the husband could be the problem. Their solution? Have him drink powdered rabbit penis mixed with wine, because apparently rabbits were considered the pinnacle of fertility, and medieval medicine believed in sympathetic magic. Chapter 11. Mental illness. Demons, humors, and holes in heads. Medieval understanding of mental illness was a fascinating mix of humoral theory, religious belief, and straight-up superstition. The prevailing view was that mental illness could have several causes. Humoral imbalances, particularly excess black bile causing melancholy, divine punishment for sins, demonic possession, witchcraft or curses, planetary influences. Treatment depended on what the doctor thought was causing the problem. For humoral imbalances, if a doctor diagnosed you with melancholy, depression, caused by excess black bile, you'd get the standard treatments: bloodletting, purging, dietary changes to introduce more hot and wet foods to counteract the cold and dry nature of black bile. They might also prescribe music therapy. This one actually isn't terrible. Pleasant smells and sights, gentle exercise, travel to change your environment, moderate wine consumption. Some of these recommendations were actually sensible. A medieval doctor accidentally stumbling into decent mental health advice is like a broken clock being right twice a day. For demonic possession, if the doctor suspected demonic possession, which was basically any mental illness with dramatic symptoms, like seizures, hallucinations, or violent behavior, treatment moved into the realm of the church. Exorcisms were performed by priests, not doctors. These involved prayer and scripture reading, commanding the demon to leave, sometimes physical restraint, or beating the patient to make the body uninhabitable for demons, holy water, relics of saints. From a medical standpoint, this was obviously useless. But from a psychological standpoint, if the patient believed in demonic possession and also believed in the power of exorcism, the ritual might have provided some placebo effect. Trepanning for mental illness. We already talked about drilling holes in heads, but it's worth mentioning that mental illness was one of the prime indications for this procedure. The theory was that madness could be caused by demons or corrupted humors trapped in the skull. Make a hole, let them out, sanity restored. Simple. This did not work. What it did do was occasionally cause brain damage that changed the patient's behavior, which doctors might interpret as a successful treatment. He's not shouting anymore. Sure, he can't speak at all now and drools constantly, but the demon is clearly gone. Restraint and isolation. For people with severe mental illness, especially if they were poor, the treatment was often just restraint and isolation. They might be chained in their family's home, locked in a church basement, or confined to early versions of asylums where conditions were absolutely horrific. No treatment, no care, just containment. Wealthy families might hide away mentally ill relatives in private chambers with attendants, but the care was often still minimal. The famous Bethlehem Royal Hospital in London, which gave us the word Bedlam, was founded in the medieval period and became notorious for its treatment of the mentally ill. Though its worst abuses came later, the medieval period established the pattern of treating mental illness through containment rather than care. One surprisingly reasonable approach. There were some medieval doctors who took a more humane approach. They recognized that mental illness might have natural causes and recommended calm environments, kind treatment, occupational therapy, keeping patients engaged in simple tasks, social interaction, good nutrition. These doctors were unfortunately in the minority, but they did exist, proving that even in the Middle Ages, some people could look at suffering and respond with compassion rather than drilling, bleeding, or exorcism. Part 4. Surgical Nightmares and Anatomical Disasters. Chapter 12. Surgery without anesthesia. An exercise in suffering. Let's talk about what it was actually like to undergo surgery in the Middle Ages. First, the good news. Medieval surgeons could actually do some impressive things. They could amputate limbs, remove bladder stones, treat cataracts, perform cesarean sections, though the mother almost never survived, repair hernias, and treat various injuries and wounds. Now the bad news, they did all of this with the patient fully conscious and in absolutely agonizing pain. Anesthesia, medieval surgeons, did have some tools to dull pain, but calling them anesthesia is generous. Alcohol. Get the patient drunk enough, and they might not remember the surgery. Of course, they'd still feel everything during it, but at least their memory would be hazy. This was probably the most common approach. Opium and mandrake. These could be made into sleeping potions that would sedate the patient. The problem? Getting the dose right was nearly impossible. Too little, and you're just groggy, but still feeling everything. Too much, and you stop breathing and die. Medieval surgeons didn't have precise measurements or standardized dosing, so it was basically a guess. The soporific sponge. This was a sponge soaked in a mixture of opium, mandrake, hemlock, and other substances. The patient would inhale the fumes from the sponge. Sometimes this worked to make them unconscious. Other times it poisoned them. Fun. Dwale. A mixture of bile, opium, lettuce, bryony, vinegar, and hemlock that was supposed to induce unconsciousness. The recipes varied, and the effectiveness was questionable. But desperate times called for desperate measures. But here's the reality. Most of the time, patients underwent surgery fully conscious with maybe some alcohol, and a lot of people holding them down. Speed was everything. Because patients were awake and in agony, the key to being a good surgeon was speed. Famous surgeons would brag about how fast they could amputate a limb. 30 seconds, 45 seconds. The faster you were, the less time the patient spent screaming and thrashing, and the less likely they were to die from shock. This emphasis on speed over precision meant mistakes happened. Surgeons might take off more than necessary just to get it done quickly. They might not have time to properly tie off blood vessels. They'd prioritize getting through the procedure over doing it carefully. Survival rates. The really horrifying thing about medieval surgery is how many people died afterward. Even if the surgery itself went well, the patient faced massive blood loss. No understanding of blood transfusions or IV fluids meant that patients who lost too much blood just died. Shock. The trauma and pain of surgery without anesthesia could send people into shock, which could be fatal. Infection. This was the big one. With no understanding of germs or sterilization, nearly every surgery introduced bacteria into the body. Surgical instruments weren't sterilized. The surgeon's hands weren't washed. The operating environment wasn't clean. Within a few days of surgery, the patient would often develop a fever. The wound would start oozing pus, which medieval doctors actually thought was good. They called it laudable pus and believed it was the body expelling bad humors. What was actually happening? Massive infection. And with no antibiotics, the patient would often die within a week or two, delirious with fever, their wound rotting. Some estimates suggest that up to 50% of surgical patients died from post-operative infections. For major surgeries like in amputations, the death rate was probably even higher. Chapter 13. Amputation. The medieval surgeon's specialty. Amputation was one of the most common surgical procedures in the Middle Ages, particularly for severe injuries where the limb was crushed or mangled beyond repair, gangrene from untreated wounds or infections, battlefield injuries, war kept medieval surgeons busy, severe frostbite, bone infections that wouldn't heal. The procedure. Let's walk through a typical medieval amputation because it's a masterclass in controlled brutality. The patient is brought in with, say, a severely infected leg. The surgeon determines that the leg needs to go before the infection spreads and kills the patient. The patient is given whatever pain relief is available, usually alcohol, and maybe some opium if the surgeon has it. They're positioned on a table and held down by assistants. because they're about to experience unimaginable pain, and their instinct will be to fight. The surgeon selects his amputation point, high enough to get above the infected tissue, but low enough to preserve as much of the limb as possible. This is a judgment call based on experience. He makes a circular cut through the skin and flesh, cutting down to the bone. Blood is everywhere. The patient is screaming. The assistants are struggling to hold them still. The surgeon then uses a saw to cut through the bone. Medieval bone saws were crude compared to modern surgical tools, so this takes physical effort and time. More screaming, more blood. Once the limb is separated, the surgeon has to deal with the blood vessels. Major arteries are spurting blood with each heartbeat. The surgeon ties them off with thread or silk. Or if he's in a hurry, he might just cauterize them with a red-hot iron, burning the vessels shut. The smell of burning flesh fills the room. Finally, the surgeon folds the skin over the stump and sews it shut. Some surgeons were skilled enough to create a proper skin flap that would heal well. Others just did their best. The whole procedure might take 5 to 10 minutes for a skilled surgeon. For the patient, it was the longest, most painful 5 to 10 minutes of their life. Battlefield amputations. Military surgeons had to perform amputations under even worse conditions. Intense, in fields, with limited supplies, and no time for careful work. After major battles, military surgeons would work for hours straight, amputating crushed limbs from dozens of soldiers. The survival rate was abysmal, but without amputation, death from gangrene was certain, so it was worth attempting. Some famous military surgeons developed innovations that improved survival rates. Ambroise Paré, 16th century, so late medieval/early Renaissance, stopped using boiling oil to cauterize wounds and started using ligatures to tie off blood vessels instead. This simple change dramatically improved survival rates. Life after amputation. If you survived a medieval amputation, your life changed dramatically. Prosthetics existed but were crude. Peg legs for amputated legs, hook hands, or simple carved wooden hands for lost hands. These were functional enough to provide some independence, but nothing like modern prosthetics. Many amputees ended up begging, as their disability made it hard to work in medieval society. Some joined religious orders where they could be supported. A few, if they were wealthy, could live comfortably with servants to help them. The amputation itself was traumatic enough. The societal consequences of losing a limb could be just as devastating. Chapter 14, Battlefield Medicine, where medieval doctors learned what actually worked. Ironically, warfare was where medieval medicine made some of its most important advances, because battlefield injuries didn't care about humoral theory. A sword wound is a sword wound, and you either treat it effectively or the soldier dies. Common battlefield injuries. Medieval warfare produced a horrific variety of injuries. Arrow wounds. Arrows could punch deep into the body, and removing them without causing more damage was tricky. Sword cuts. These could be shallow or deep, and might cut through muscle, tendons, even bone. Blunt trauma. Maces, hammers, and war hammers could shatter bones and cause internal injuries. Crossbow bolt wounds. Similar to arrows, but often more powerful. Burns from boiling oil, Greek fire, or burning buildings. Infections. Battlefield wounds almost always got infected. Treating arrow wounds. Arrows were particularly challenging because of their barbed heads. Pull them straight out and you'd tear a massive wound. Push them through and out the other side, and you'd cause even more damage. Medieval surgeons developed specialized tools called arrow spoons, or arrow extractors, devices that would grip the arrowhead so it could be removed without the barbs catching on flesh. The process was excruciating for the patient. The surgeon would probe the wound with instruments to locate the arrowhead, then use the extractor to pull it out. If the arrow had gone deep or hit bone, this could take a long time and cause significant additional trauma. Treating sword wounds. Deep sword cuts required immediate action to stop bleeding and close the wound. Surgeons would 1. Stop the bleeding by applying pressure, tying off vessels, or cauterizing 2. clean the wound, though clean in medieval terms just meant removing obvious dirt and debris. 3. Sew it shut with needle and thread. 4. Bandage it and hope for the best. Shallow cuts might be treated with various ointments and salves, some of which actually had antibacterial properties, though medieval doctors didn't know that, like those containing honey or wine. The problem of infection. Battlefield wounds got infected almost 100% of the time. The weapons weren't clean, the battlefield was filthy, and the treatment wasn't sterile. Medieval military surgeons noticed that wounds that started oozing pus would often get hot, red, and swollen, and the patient would develop a fever. They didn't understand infection, but they knew it was bad. Their treatment? More bloodletting to reduce the heat, applying various poultices and ointments, and prayer. Sometimes it worked. The wound would heal despite the treatment. Often it didn't. The patient died of sepsis. Chapter 15. The healing salves and miracle ointments, most of which did nothing. Medieval medicine was absolutely obsessed with topical treatments. If you couldn't fix a problem from the inside with bloodletting and purging, maybe you could fix it from the outside with the right combination of weird ingredients smeared on the affected area. Common ingredients in medieval ointments. The ingredient lists for medieval medical salves read like a combination of a spice cabinet, a graveyard, and a fever dream. Animal parts. Ground up earthworms for joint pain. Powdered crab eyes for eye problems naturally. Bear grease for baldness. Apparently they thought bears had great hair. Goose grease for pretty much everything. Rendered fat from various animals. Bone marrow. Bile from different animals. Spider webs. Actually not terrible for stopping bleeding, as they can act as a coagulant. Snail slime, which actually does have some beneficial properties. Plant materials. Dozens of different herbs, many of which actually did have medicinal properties. Tree resins and saps, flower petals, seeds and roots, moss scraped from skulls. Yes, really, and it was expensive. Minerals and metals. Mercury, toxic, but they used it anyway. Lead, also toxic, also used frequently. Sulfur, salt, various groundstones and minerals. The truly bizarre. Urine, human or animal, and yes, they used it topically. Dung from various animals. Pigeon dung was particularly popular. Ground up mummies from Egypt, called mummia. And yes, they literally ground up ancient Egyptian mummies for medicine. Unicorn horn powder, which was actually narwhal tusk or just regular animal horn. Powdered precious stones, because if it's expensive, it must work, right? Famous medieval ointments. Theriac. This was the aspirin of the Middle Ages, a supposed cure-all that wealthy people paid enormous sums for. The recipe for theriac allegedly contained 64 different ingredients, including opium, myrrh, viper flesh, cinnamon, and dozens of herbs. Different makers had their own secret recipes, and theriac from certain cities, particularly Venice, was considered superior. Did it work? Well, it contained opium, so it definitely made people feel better in the short term. Whether it cured anything is debatable, but people swore by it, and it remained popular for literally hundreds of years. The Four Thieves vinegar. According to legend, during a plague outbreak, 4 thieves were caught robbing the bodies of plague victims. When asked how they avoided getting sick, they revealed their secret: a vinegar infusion containing dozens of herbs. Different recipes exist, but most include vinegar, garlic, and various herbs like rosemary, sage, and lavender. People would drink it, bathe in it, or use it as a topical application. Did it work against plague? No. Did the strong smell possibly keep fleas at a distance? Maybe. Did the herbs have any antibacterial properties? Some of them might have had mild ones, but mostly it was probably placebo effect and luck. Chapter 16. Cautery revisited. The full horror. We touched on cauterization earlier, But we need to go deeper because this was such a fundamental part of medieval surgical practice. Medieval surgeons had entire sets of cautery irons in different shapes and sizes, each designed for specific purposes. Pointed irons for creating small, precise burns, button-shaped irons for larger circular burns, flat irons for burning larger areas, curved irons for following the contours of the body, the different types of cautery, actual cautery. This was the straightforward, heat up a metal rod and press it against flesh approach, used for stopping bleeding from wounds, burning off tumors or growths, creating counter-irritation for pain relief, treating hemorrhoids. Yes, really, and exactly as horrifying as it sounds, preventing infection. It actually kind of worked by killing surface bacteria. Potential cautery. This involved applying caustic substances to the skin that would burn it chemically rather than with heat. Substances used included quicklime, caustic alkalis, acids, certain plant extracts. The advantage? No need to heat up irons. The disadvantage? Harder to control how deep the burn went, and the substances themselves could cause additional problems. The cautery treatment for specific conditions. Headaches, cauterize the temples or back of the neck. The theory was that the burn would draw out the bad humors causing the headache. The reality was that you now had a headache and severe burns on your head. Gout, cauterize the affected joints. This did nothing for the underlying uric acid crystal deposits causing gout, but it did create painful burns that probably distracted from the gout pain. So, success? Hemorrhoids. Okay, this one deserves special mention because it's particularly brutal. Surgeons would cauterize hemorrhoids with hot irons to burn them off. No anesthesia, just a red-hot iron applied to one of the most sensitive areas of the body. The survival rate was actually decent. Hemorrhoid treatment didn't usually kill people, but the suffering was immense. Some patients apparently preferred to just live with the hemorrhoids rather than undergo the treatment. Epilepsy. Some doctors recommended cauterizing the top of the head to release the vapors they believed caused seizures. This did not cure epilepsy, shockingly. The justification. Medieval doctors genuinely believed cautery worked through multiple mechanisms. Heat purified corrupted flesh. Burns created an exit route for bad humors. The counter-irritation principle. Create a new pain to distract from the old pain. Fire was associated with purity in medieval thought, so burning must purify. They had elaborate theories about when to cauterize, where to cauterize, and how hot the iron should be. It was a whole science built on the foundation of causing controlled burns to sick people. Part 5. Specific diseases and their treatments. Chapter 17. Leprosy, the disease that terrified medieval Europe. Leprosy, Hansen's disease, was one of the most feared diseases in medieval Europe, partly because of its visible effects and partly because of biblical associations with uncleanliness and divine punishment. Medieval understanding of leprosy. Medieval doctors had absolutely no idea what caused leprosy. Their theories included divine punishment for sin, corrupted humors, particularly an excess of black bile, bad air and miasmas, hereditary transmission, sexual intercourse with menstruating women, because medieval medicine was deeply misogynistic, eating certain foods, particularly rotten fish. None of these were correct. Leprosy is actually caused by bacteria, Mycobacterium leprae, but that wouldn't be discovered until 1873. Diagnosis. Diagnosing leprosy was serious business because it came with severe social consequences. Suspected lepers would be examined by a panel that might include doctors, clergy, and sometimes other people who had been diagnosed with leprosy. They looked for signs like skin lesions and discoloration, loss of sensation in extremities, facial disfigurement, loss of fingers or toes. If diagnosed with leprosy, the person would be declared legally dead. They'd have a funeral service performed for them while they were still alive. They'd be forbidden from entering towns, required to wear identifying clothing, forced to carry a bell or clapper to warn others of their approach, and sent to live in leper colonies called leprosaria. It was a social death sentence. Treatments. Despite the harsh social response, doctors did attempt to treat leprosy with their usual mix of ineffective and bizarre remedies. Bloodletting. Of course, remove the corrupted blood, balance the humors. Didn't work. Dietary changes. Lepers were often prescribed diets heavy in hot and moist foods to counteract the cold and dry nature of the disease. This meant lots of wine, fatty meats, and rich foods. Didn't cure leprosy, but at least the food was probably good. Viper flesh. Some doctors recommended eating viper flesh or drinking viper blood. The logic was that vipers shed their skin, so eating them would help the leper's corrupted skin renew itself. This is the medieval version of "you are what you eat," taken to a horrifying extreme. Sulfur baths. Bathing in water mixed with sulfur was a common treatment. Sulfur does have some antibacterial properties, so this might have helped with secondary skin infections, but it didn't cure leprosy. Herbal poultices. Various mixtures of herbs would be applied to the lesions. Some of these might have had mild beneficial effects on skin health, but again, not curing the underlying bacterial infection. Mercury treatments. Because medieval doctors loved using toxic substances, mercury was sometimes prescribed for leprosy. This added mercury poisoning to the list of the patient's problems. The reality: most of these treatments did nothing for the underlying disease. However, the isolation in leprosaria, while socially devastating, might have actually helped in one way. It prevented transmission to others. Many lepers lived for years, or even decades, with the disease. The leprosaria were often run by religious orders and provided food, shelter, and care, which was better than many poor people got even without leprosy. Some people diagnosed with leprosy didn't actually have it. They had other skin conditions that medieval diagnostics couldn't distinguish from true leprosy. Those people might appear to recover through treatment, which reinforced doctors' belief that their remedies worked. Chapter 18. Ergotism. The fire that consumed you from within. Here's a disease that medieval doctors completely failed to understand. Ergotism, also called St. Anthony's fire. What actually caused it? Ergotism is caused by eating grain, usually rye, contaminated with ergot fungus. The fungus produces alkaloids that are toxic to humans and cause two main types of symptoms. Gangrenous ergotism, blood vessels constrict, cutting off circulation to extremities. Fingers, toes, hands, and feet would turn black and essentially mummify while the person was still alive. Eventually, they'd drop off. The pain was excruciating, hence fire. Convulsive ergotism causes hallucinations, muscle spasms, seizures, and psychotic episodes. Medieval understanding, 0. They had no idea what caused it. Some thought it was divine punishment. Others blamed bad air or corrupted humors. The association with St. Anthony came from the belief that praying to this saint could cure the disease. It couldn't, but sometimes moving to pray at a distant shrine meant eating different grain that wasn't contaminated, so people sometimes recovered. Treatments. Amputation. For gangrenous ergotism, once the extremities had turned black and dead, amputation was the only option. Medieval surgeons would cut off the dead fingers, toes, hands, or feet. The horrible thing? Sometimes the ergotism would continue to progress even after amputation, requiring further amputations higher up the limb, bloodletting, and purging. The standard responses to any disease didn't help. Religious treatments, prayers, pilgrimages to shrines of St. Anthony, blessed bread. The blessed bread sometimes actually helped, but only because it was made from different grain that wasn't contaminated. Cooling treatments. Because patients complained of burning sensations, some doctors prescribed cooling treatments, cold water baths, cold compresses, cold foods. This probably provided temporary relief from pain, but didn't address the underlying poisoning. The tragic irony: the cure for ergotism was simple. Stop eating contaminated grain. That's it. But medieval doctors didn't understand this, so they kept treating the symptoms while patients continued consuming the very thing that was poisoning them. Ergotism epidemics could affect entire villages or regions when a harvest was particularly contaminated. Dozens or even hundreds of people would develop these horrifying symptoms simultaneously, which reinforced the belief that it was divine punishment or pestilence in the air, rather than something in the food supply. Chapter 19: Dental Care, or the lack thereof. Medieval dental care deserves its own section because it was a special kind of horror show. The state of medieval teeth. Medieval teeth were, generally speaking, terrible. The combination of poor nutrition, no concept of dental hygiene, and diets that were often quite hard on teeth meant that tooth decay and dental pain were extremely common. However, there's an interesting caveat. Before refined sugar became common in Europe, which didn't happen until after the medieval period, tooth decay wasn't quite as catastrophic as it became later. Medieval people's teeth were often worn down from gritty bread and tough foods, but they weren't necessarily rotting out of their heads the way they would in later centuries. Dental diagnosis, medieval. Understanding of what caused dental problems was, predictably, wrong. They believed tooth pain could be caused by worms living inside the tooth, the toothworm theory, which dated back to ancient Mesopotamia. Humoral imbalances, bad vapors rising from the stomach. Divine punishment. The toothworm theory was particularly persistent. There are medieval illustrations showing tiny worms inside teeth causing pain. Some treatments were specifically designed to draw out or kill these imaginary worms. Dental treatments. Tooth extraction. When a tooth was too painful or too decayed, the solution was simple: rip it out. Barber surgeons typically handled tooth extractions. They had special pliers called dental pelicans, or tooth keys, designed to grip teeth and wrench them out of the jaw. The procedure was brutal. 1. No anesthesia beyond maybe some alcohol. 2. The barber surgeon would grip the tooth with the tool 3. They'd twist and pull with considerable force. 4. Sometimes the tooth would come out cleanly. 5. Other times it would break, requiring multiple attempts to remove the remaining fragments. 6. Sometimes part of the jawbone would come out with the tooth. Patients would have to be held down during the procedure because the pain was so intense they'd instinctively fight back. Cauterization. For infected teeth or gums, some practitioners would use hot irons to burn away the infected tissue. This is exactly as horrible as it sounds. Treatments for the toothworm. Since many doctors believed in toothworms, they developed treatments specifically for this imaginary problem. Fumigation. Hold the patient's mouth over a bowl of boiling water mixed with various herbs and substances. The steam was supposed to drive the worms out. Spoiler, it didn't, because the worms didn't exist. Poultices and pastes. Apply mixtures to the tooth designed to kill or drive out the worm. Ingredients might include henbane, which is toxic and could actually kill you, pepper, vinegar, various herbs, sometimes mercury, because why not add poisoning to your dental problems? Magical incantations. Yes, really. Some tooth pain treatments involved reciting specific prayers or spells while applying the medicine. The belief was that you needed both physical and spiritual treatment to dislodge the worm. Preventive dental care. The concept of preventive dental care barely existed, but there were some recommendations. Tooth cleaning. Some medieval sources recommend rubbing teeth with a cloth, sometimes moistened with wine or sage water. This is actually not terrible advice. Tooth powders. Ground up substances used to clean teeth, which might include salt. Actually works pretty well. Crushed eggshells, burned bread, powdered herbs, ground up cuttlefish bone. Dietary advice. Some doctors recommended avoiding very hard foods that could damage teeth and avoiding very sweet foods, though this was more about humoral balance than understanding sugar's role in decay. Mouthwashes, various rinses made from wine, vinegar, herbs, or rosewater. Some of these probably did help with oral hygiene by killing bacteria, though medieval doctors didn't understand the mechanism. The social impact. Losing teeth was extremely common in the Middle Ages, even among the wealthy. By middle age, many people were missing several teeth. This affected eating, making it harder to chew certain foods, speech, creating lisps or other speech impediments, and appearance. There was no concept of cosmetic dentistry, though some very wealthy people might have false teeth, made from ivory, bone, or even teeth pulled from poor people or corpses. Chapter 20. Eye problems, when doctors literally poked at your eyeballs. Medieval ophthalmology was another field where ignorance met overconfidence with predictably terrible results. Cataracts. Cataracts were common, especially among the elderly, and medieval surgeons actually could treat them, sort of. The procedure, couching. The medieval technique for cataracts was called couching. Here's how it worked. The surgeon believed that cataracts were caused by a substance that had settled in front of the pupil, blocking vision. This is sort of correct. Cataracts are a clouding of the lens, which is indeed in front of the retina, though the medieval understanding of eye anatomy was very wrong. The solution? Push the cataract out of the way. The surgeon would take a needle, a large, thick needle, and insert it into the eye from the side. Then they'd use the needle to physically push the clouded lens down and back, out of the line of sight. If done successfully, the patient could see again, though their vision would be very blurry because they no longer had a lens to focus light. But blurry vision was better than blindness, so patients considered this a win. The problems? No anesthesia. At most, some numbing drops made from various plant extracts. No understanding of infection, so eye infections after the procedure were common. If the surgeon pushed too hard or in the wrong direction, they could damage the retina or cause bleeding inside the eye, leading to permanent blindness. Even successful procedures could fail later if the displaced lens moved back into the field of vision. Despite these risks, couching was performed throughout the medieval period and actually continued well into the 18th century. It was one of the few surgical procedures where medieval surgeons had some genuine success. Other eye problems. For most eye problems, medieval treatments range from useless to actively harmful. Eye infections, treated with various washes and drops made from breast milk, which actually might have had some antibacterial properties from antibodies, rosewater, wine, various herb infusions, bile from animals, sometimes caustic substances that probably damaged the eye further, vision problems. Medieval doctors had no real treatment for nearsightedness or farsightedness. Reading glasses weren't invented until late in the medieval period, and even then, they were rare and expensive. Blindness. If someone went blind, medieval medicine had little to offer beyond prayers and pilgrimages to saints associated with vision. The theory. Medieval doctors believed eyes worked by emitting rays that touched objects, allowing you to see them. Yes, they thought your eyes projected vision outward, rather than receiving light from objects. This backward understanding of vision led to some strange treatment theories. If your eyes were weak and not projecting rays properly, you needed to strengthen them with various tonics and treatments. Part 6. The successes. Yes, there were a few. Chapter 21. What medieval medicine actually got right. Okay, so we've spent a lot of time dunking on medieval medicine, and for good reason. Most of it was terrible. But in the interest of fairness, let's talk about the things they actually got right, or at least partially right. Herbal medicine. While medieval doctors' theoretical understanding was wrong, many of their herbal remedies actually worked because they contained active compounds with genuine medicinal properties. Willow bark, used for pain and fever, contains salicin, which the body converts to salicylic acid, essentially natural aspirin. This genuinely worked. Digitalis, foxglove. Used for heart conditions. Dangerous if dosed incorrectly, but actually effective for certain cardiac issues because it contains compounds that affect heart rhythm. Opium poppy. Used for pain relief and to induce sleep. Definitely worked because, well, it's opium. St. John's wort. Used for melancholy, depression. Modern research suggests it may have some antidepressant effects for mild to moderate depression. Valerian root, used for sleep and anxiety. Still used today as a natural sleep aid and does have mild sedative properties. Chamomile, used for digestive issues and as a calming agent, actually does have anti-inflammatory and mildly sedative effects. Honey, used on wounds, actually has antibacterial properties and can promote healing. Medieval doctors didn't know why it worked, but they were right that it did. Garlic, used for various ailments, does have antibacterial and antifungal properties, though probably not to the extent medieval doctors believed. The problem was that medieval doctors didn't understand which specific compounds in these plants were active, what doses were appropriate, or which conditions they actually helped with. So they'd throw herbs at every problem hoping something would stick. Surgical techniques. Medieval surgeons, especially those who worked on battlefields, developed some genuinely useful techniques. Ligatures, tying off blood vessels with thread to stop bleeding was more effective and less damaging than cauterization. Some surgeons figured this out and used it successfully. Wound closure, suturing wounds with needle and thread, was practiced and helped wounds heal better than leaving them open. Traction, for broken bones, applying steady pulling force to realign the bones was actually correct treatment, and medieval surgeons did this. Splinting, immobilizing broken bones with splints to allow them to heal straight, was standard practice and actually worked. Bone setting. Skilled bone setters could manipulate dislocated joints back into place or set broken bones reasonably well. Practical hygiene. Sometimes, while medieval medicine didn't understand germ theory, some practices accidentally promoted hygiene. Wine on wounds. Wine is alcoholic and acidic, which does have some antibacterial effect. Using wine to clean wounds was better than using dirty water. Separate spaces for the sick. Plague. Hospitals and leprosaria isolated sick people from healthy populations, which, regardless of the reasoning, did help prevent disease spread. Some food safety practices. Recommendations to avoid spoiled food, though based on wrong theories about humors, did help prevent foodborne illness. Quarantine. As mentioned earlier, the practice of quarantine developed during plague outbreaks and actually worked to slow disease spread. Midwifery. Experienced midwives developed practical knowledge about childbirth that was often more useful than the theoretical knowledge of male physicians who'd never attended a birth. Good midwives knew how to tell if labor was progressing normally, how to reposition a baby that was presenting poorly, how to help control bleeding after delivery, which herbs could help with pain or stimulate contractions, how to care for newborns. While maternal and infant mortality was still high by modern standards, skilled midwives made a genuine difference in outcomes. Voilà environ 6500 mots. Continuons avec environ 6500 mots supplémentaires. Chapter 22. The Hospital System, Medieval Healthcare, Infrastructure. One genuinely positive development in medieval medicine was the establishment of hospitals, though they were very different from modern hospitals. The evolution of medieval hospitals. Early medieval hospitals were primarily religious institutions, focused on providing care and comfort to the sick, elderly, and poor rather than curing disease. Monastic hospitals. Many monasteries had infirmaries, not just for monks, but for travelers and the local poor. Monks and nuns provided care, which included food and shelter, basic medical treatment, spiritual comfort, a clean place to rest and recover hospices. These facilities focused on care for the terminally ill, the elderly, and travelers. The word hospital actually comes from the Latin hospes, meaning guest or host, specialized hospitals. As the medieval period progressed, more specialized institutions developed: leper hospitals, leprosaria, facilities specifically for people with leprosy. By the 13th century, there were thousands of these across Europe. Plague hospitals developed during major plague outbreaks to isolate the sick, hospitals for the insane. Some facilities specifically housed people with mental illness, though the care was often minimal. Military hospitals, the Knights Hospitaller, and similar orders established hospitals to care for wounded crusaders and pilgrims. What hospitals actually did: medieval hospitals focused on care rather than cure, basic medical treatment, simple procedures like bandaging wounds, setting broken bones, and administering herbal remedies. Nutrition. Regular meals were often the most beneficial thing hospitals provided. Many sick poor people were malnourished, and simply getting adequate food helped recovery. Rest. A clean, dry place to sleep was valuable for people who might otherwise be sleeping on the streets or in squalid conditions. Spiritual care, prayer, confession, and last rites. In an era when people believed in the afterlife, dying with spiritual support was considered crucial. Isolation. For contagious diseases, hospitals removed sick people from crowded households where they might infect others. The hospital experience. Medieval hospitals were not places you went to be cured and discharged quickly. People might stay for weeks, months, or even years. Wards were often large rooms with multiple beds. Privacy didn't exist. The sick, the dying, and the recovering all shared space. Care was provided by religious brothers and sisters, paid attendants, though wages were low, so quality varied. Sometimes wealthy benefactors who volunteered, occasionally physicians who would visit to consult on difficult cases. The limitations. Medieval hospitals couldn't cure most diseases, but they did provide a better environment for recovery than many people had at home. Basic care and comfort. Reduced transmission of disease through isolation. Food and shelter for the destitute sick. For all their limitations, medieval hospitals represented organized societal care for the sick, which was a genuine advance over leaving people to suffer alone. Chapter 23. The influence of Arabic medicine. One of the most important developments in medieval European medicine was the translation and adoption of Arabic medical texts. The Islamic Golden Age. While Western Europe was struggling through the early medieval period, Islamic scholars were preserving, translating, and expanding upon ancient Greek and Roman medical knowledge. Physicians like Avicenna, Ibn Sina, wrote the Canon of Medicine, an encyclopedic medical text that became the standard medical textbook in both the Islamic world and Europe for centuries. Rhazes. Al-Razi made important observations about diseases and wrote extensively about clinical medicine. Al-Bucasis, Al-Zarawi, wrote comprehensive surgical texts with illustrations of surgical instruments and procedures. What Arabic medicine brought to Europe: better surgical knowledge. Arabic texts described surgical procedures in detail with illustrations, advancing European surgical techniques. Pharmacology. Arabic physicians had access to drugs and substances from across the Islamic world's trade networks. They documented hundreds of medications and their uses. Clinical observation. Arabic medical texts emphasized observing patients and documenting symptoms, which was more practical than the purely theoretical approach common in early medieval Europe. Hospital organization. The concept of well-organized hospitals with separate wards for different conditions came to Europe partially through Islamic influence. Hygiene practices. Arabic medicine emphasized cleanliness more than early medieval European medicine did. The translation movement. In the 11th to 13th centuries, major efforts were made to translate Arabic medical texts into Latin. Places like Toledo in Spain, where Islamic and Christian cultures mixed, became centers of translation. These translations reintroduced Europeans to Greek medical knowledge they'd lost and added new Arabic discoveries and practices. The impact, the influx of Arabic medical knowledge raised the level of European medicine. Medical schools began using translated texts. Surgical techniques improved. Pharmacology expanded. However, European doctors still clung to humoral theory and other flawed concepts, so the impact was limited. They'd gained better tools and knowledge, but were still working within a fundamentally incorrect theoretical framework. Chapter 24. Women in Medieval Medicine. Despite being largely excluded from formal medical education and practice, women played crucial roles in medieval healthcare. Midwives. Midwifery was almost exclusively a female profession. Every community had midwives who attended births. Training, learned through apprenticeship. Usually an experienced midwife training a younger woman, often a relative. Responsibilities, attending labor and delivery, cutting the umbilical cord, ensuring the newborn started breathing, delivering the placenta, caring for mother and child after birth, dealing with complications. Social status varied widely. In some communities, midwives were respected and well compensated. In others, they were viewed with suspicion, especially if babies or mothers died. The witch hunt connection. During the late medieval period and into the early modern era, midwives were sometimes accused of witchcraft, especially if they had knowledge of herbs that could induce abortion or if multiple births under their care went wrong. Wise women and healers. In villages and rural areas, wise women served as informal healthcare providers. They knew which herbs treated which ailments, how to make poultices and remedies, basic first aid, sometimes bone setting, and wound care. These women were accessible and affordable, making them the primary healthcare providers for most poor people. Nuns. Convents often had infirmaries and herb gardens. Nuns provided medical care to other nuns, the poor, pilgrims, and travelers. Some nuns became quite knowledgeable about herbal medicine and basic care. The Benedictine abbess Hildegard of Bingen wrote extensive texts on natural history and medicine in the 12th century. Female physicians, rare but existent. Although universities excluded women, there are documented cases of female physicians in medieval Europe. Trotula of Salerno, possibly the most famous, though there's debate about whether Trotula was one woman or a collection of texts by multiple female authors. The texts attributed to her dealt with women's medicine and were influential throughout the medieval period. Jacqueline Félicier de Almania practiced medicine in 14th century Paris and was prosecuted for practicing without a license from the university, which didn't admit women. Witnesses testified that she was highly skilled and had cured patients when university-trained physicians had failed, but she was still convicted. Some Jewish women practiced medicine, as Jewish communities sometimes had different attitudes toward women's education and professional activity. The restrictions. Women faced enormous barriers in formal medical practice. Banned from universities, often prohibited from joining physicians' guilds, faced prosecution if they practiced medicine illegally. Their medical knowledge was sometimes labeled as witchcraft. Despite these obstacles, women continued to provide the majority of day-to-day healthcare, especially for other women and children. Chapter 25. The slow dawn of anatomical knowledge. One of the biggest problems with medieval medicine was fundamental ignorance of human anatomy. You can't effectively treat the body if you don't understand how it's structured. Why anatomical knowledge was limited. Religious restrictions. The Catholic Church had complicated and sometimes contradictory positions on dissection. In general, dissecting human bodies was viewed with suspicion and was often forbidden or heavily restricted. cultural attitudes. There was deep reverence for the dead body and concern about proper burial and resurrection. Cutting up corpses seemed sacrilegious. Reliance on ancient texts. Physicians trusted Galen's anatomical writings, which were based largely on animal dissection rather than seeking direct knowledge. Social barriers. Actually cutting into bodies was considered crude manual labor beneath the dignity of learned physicians. The gradual change. Starting in the late medieval period, attitudes slowly began shifting. Bologna. The University of Bologna began allowing limited human dissection for teaching purposes in the late 13th century. These were rare events, maybe one per year, but they represented progress. The public anatomy. Dissections became public events. The professor would sit in a chair reading from Galen while a barber surgeon did the actual dissecting, and an assistant pointed to the relevant parts. The problem? If what they found didn't match Galen's descriptions, they assumed the body was abnormal rather than questioning Galen. Mondino de Luzzi. In the early 14th century, this Italian physician wrote Anatomia, the first European dissection manual based on actual human dissection rather than just translating ancient texts. It contained errors, but it represented direct observation. The impact. Even limited anatomical study began revealing problems with accepted theories. The heart had 4 chambers, not 3 as Galen claimed. Blood vessels didn't exactly follow Galen's descriptions. Many structures didn't quite match the ancient texts, but wholesale rejection of humoral theory and Galenic medicine would have to wait until the Renaissance and beyond. Medieval physicians were seeing evidence that contradicted their theories, but couldn't quite bring themselves to abandon the entire framework they'd built their profession on. Anatomical understanding by end of medieval period. By 1500, physicians had better, though still imperfect, knowledge of skeletal structure, major organs and their locations, blood vessels, though not how circulation actually worked, muscular system, partially. They still didn't understand how blood actually circulated. Harvey wouldn't discover this until 1628. The role of organs like the pancreas and spleen, the nervous system beyond the most basic level, cellular structure, microscopes didn't exist yet. Pretty much all of biochemistry and microbiology. So while there was progress, medieval medicine ended with doctors still fundamentally ignorant of how the body actually worked. Voilà environ 6500 mots supplémentaires. Continuons avec une dernière section d'environ 6500 mots, puis la conclusion. Part 7. The patient, experience, and social aspect. Chapter 26. What it was like to be a patient. Let's put ourselves in the shoes, or more accurately, the disease-ridden body, of a medieval patient and walk through what seeking medical care actually involved. Getting sick. You're a merchant in 14th century England. You wake up one morning with a fever, body aches, and a nasty cough. In the modern world, you might take some ibuprofen and see if it passes. In medieval times, you're immediately concerned because you know illness can kill, and medicine's track record isn't great. Decision time. You have several options for seeking care. Do nothing. Cheapest option. Maybe you'll get better on your own. Many people did, because most illnesses are self-limiting. Of course, some got worse and died, so it's a gamble. Home remedies. Your wife makes you some herbal tea based on her mother's recipe. You eat some garlic. Maybe you pray to Saint Sebastian, patron saint of plague, just in case. Cost minimal. Visit the local wise woman. She's affordable and has a good reputation for treating fevers. She examines you, feels your pulse, looks at your tongue, and prescribes an herbal infusion to drink 3 times daily, a poultice to place on your chest, instructions to avoid cold, wet foods, maybe some bloodletting if she thinks your blood is too hot. Cost a few coins or maybe some trade goods, manageable for a merchant. Visit a barber surgeon. He's got more formal training than the wise woman. After examining you, he recommends bloodletting to balance your humors, a purge to expel bad humors through your bowels, cupping on your back. Some medicinal wine cost more. Expensive, but still within reach. Consult a physician. This is the fancy option. The physician examines your urine in his special flask, feels your pulse in multiple places, asks about your diet, habits, and recent activities. Consult his astrological charts, diagnoses an imbalance of hot and cold humors, prescribes an elaborate treatment plan involving diet changes, bloodletting, herbal medicines from the apothecary, and specific behaviors. Cost expensive. You'll pay dearly for this consultation. The treatment experience. Let's say you went with the barber surgeon. The bloodletting procedure. You sit in a chair in his shop. He ties a tourniquet around your arm. He selects a vein and makes a cut with his fleam. Blood starts flowing into a bowl. You watch your blood pour out, feeling lightheaded. The barber surgeon is watching the blood's color and consistency, looking for signs of corruption. When he decides enough blood has been let, he bandages the wound. You're dizzy, weak, and your arm hurts. You go home to rest as instructed. Over the next few days, you feel worse before you feel better, because you're now anemic on top of being sick. Eventually, your fever breaks, because your immune system fought off the infection, not because of the bloodletting. You recover and credit the barber surgeon's treatment. Next time you're sick, you'll seek his services again. The cost of medical care. Medical care in the Middle Ages created serious financial burdens for the poor. Serious illness could mean financial ruin. Even affordable treatments from wise women or barber surgeons might require money they didn't have. Many poor people simply suffered without treatment or relied on charity. For the middle class, a merchant or craftsman could afford basic care, but serious illness requiring extended treatment or multiple consultations could drain savings. For the wealthy, could afford the best physicians and expensive medicines, though this didn't necessarily mean better outcomes. They just paid more to receive the same ineffective treatments. Hospitals for the poor. Charitable hospitals provided free care, which was a lifeline for the destitute. The care was basic, but it was something. Chapter 27. The Apothecary. Medieval Pharmacy. The apothecary shop was a crucial part of medieval medical infrastructure. Let's explore what you'd find there. The shop. Picture a room with shelves lined with jars, bottles, and boxes containing hundreds of substances. Dried herbs hanging from the ceiling. A mortar and pestle for grinding ingredients. Scales for measuring precise amounts. Account books recording recipes and sales. A distinctive smell from the mixture of herbs, spices, and other substances. The inventory. A well-stocked apothecary might have. Plant materials. Dozens of dried herbs, each supposedly treating different conditions. Bark, roots, seeds, and flowers. Resins and gums. Spices imported from far away. Expensive. Animal products. Dried organs from various animals. Ground up insects, bone, horn, and ivory powder. Sometimes mumia. Ground up mummies. Exotic items like unicorn horn, fake, or bezoar stones, real but not magical. Minerals. Sulfur, mercury, lead. Various salts. Ground gemstones. Metals in powder form. Prepared medicines. Pills made from compressed powder, syrups and elixirs. Ointments and salves. Poultices. Medicinal wines. Theriac and other compound medicines. The apothecary's role. The apothecary did several things. Filled prescriptions. When a physician prescribed a medicine, the patient brought the prescription to an apothecary, who would prepare it according to the physician's specifications. Provided medical advice. Though technically not supposed to diagnose or treat, apothecaries often did provide advice on common ailments, especially for customers who couldn't afford a physician. Compounded medicines. Mixed ingredients according to traditional recipes or their own experimentation. Sold preventive remedies. items people bought to ward off disease, like aromatic pomanders to protect against plague. The recipe books. Apothecaries had recipe books, sometimes called antidotaries, containing formulas for various medicines. Some recipes were trade secrets passed down through families. Others came from published medical texts. A recipe might specify exact ingredients and amounts, preparation method, grinding, boiling, fermenting, etc., how to administer the medicine, what condition it treated, quality control, or lack thereof. Some apothecaries were skilled and conscientious, carefully preparing medicines according to proper recipes. Others were less scrupulous, substituting cheaper ingredients for expensive ones, diluting expensive substances, using spoiled or low-quality materials, making up impressive sounding remedies that did nothing. In larger cities, apothecary guilds tried to regulate quality and prevent fraud, but enforcement was inconsistent. The poison problem. Many medicinal substances were toxic if dosed incorrectly. Mercury, lead, arsenic, various plant-based poisons like hemlock, belladonna, and henbane. A skilled apothecary knew the difference between a therapeutic dose and a lethal one. A careless or ignorant one might accidentally poison customers. There are documented cases of apothecaries being prosecuted and sometimes executed for deaths caused by incorrect preparations. Chapter 28. Medical Fraud and Quackery. Every era has its con artists, and medieval medicine was a target-rich environment for fraudsters. The traveling charlatan. Picture a guy who rolls into town with a cart full of bottles and a big smile. He sets up in the market square and starts his pitch. Good people of town name, I bring you a miracle cure from the distant east. This elixir, prepared by the wisest physicians of Arabia, can cure all fevers, any pain, digestive complaints, infertility, impotence, plague, maybe, general unwellness, and restore youthful vigor. Only 3 silver coins for this precious remedy that would cost 10 times as much from your local apothecary. People crowd around. The charlatan has confederates in the crowd who testify to the elixir's miraculous effects on them. I was dying of fever, 1 dose and I was cured. Desperate, hopeful people buy bottles. The charlatan collects a small fortune and leaves town before anyone realizes the miracle elixir is basically flavored water or wine with some herbs mixed in. The fake relic seller. Religious relics were believed to have healing power. A bone from a saint, a piece of the true cross, or a vial of holy oil could supposedly cure illness. This created a massive market for fake relics. Animal bones sold as saints' bones. Random wood scraps sold as pieces. Of the cross, regular oil or water blessed, maybe, and sold as miraculous. Churches and monasteries sometimes got in on this, displaying dubious relics to attract pilgrims and their money. The more cynical clergy knew the relics were fake, but justified it by saying people's faith in the relic, not the relic itself, produced healing. The fake physician. Some con artists would pose as learned physicians, complete with fancy robes and Latin phrases, despite having no medical training whatsoever. They'd set up practice in a new town, treat patients using impressive sounding but made-up procedures, collect fees, and then disappear before their complete incompetence became too obvious. In an era before medical licensing was standardized, it was hard to verify someone's credentials, especially if they claimed to be from a distant university. The astrologer physician. Some fraudsters combined medicine with astrology, offering to cast detailed horoscopes that would reveal the perfect treatment for any condition. They'd create elaborate star charts, make confident predictions, prescribe treatments, and charge huge fees for this specialized service. The genius of this scam was that if the treatment didn't work, they could blame the patient for not following the astrological timing precisely, or claim that other planetary influences interfered. How to Spot a Quack, Medieval Edition. Some warning signs that your medieval doctor might be a fraud. Promises of miracle cures. Secret ingredients or methods. Prices that seem too good to be true. Refusal to explain treatments. Quick to leave town. No fixed address or practice location. Claims to have trained at distant, unverifiable institutions. Lots of testimonials from people nobody knows. Of course, legitimate medieval doctors were often ineffective too, so even avoiding fraudsters didn't guarantee good care. Chapter 29. Regional variations in medieval medicine. Medical practice varied significantly across medieval Europe and the Mediterranean. Italy. Italian medical schools, particularly Salerno and Bologna, were among the most advanced in Europe. Earlier adoption of human dissection, strong influence from Arabic medicine through trade connections, more emphasis on observation in clinical practice, development of hospitals and medical organization. Italian physicians were in demand across Europe and often served at royal courts. France. The University of Paris became a major medical center, though it was more conservative than Italian schools. Strong emphasis on theoretical knowledge. Slower to adopt anatomical study. Influenced by both Arabic texts and classical sources. Paris physicians were prestigious, but often very traditional England. English medicine was somewhat behind continental Europe in the early medieval period, but caught up later. Universities at Oxford and Cambridge trained physicians, strong tradition of monastic medicine. Royal physicians had significant influence. Local variations in practice, with rural areas relying heavily on wise women and herbalists. Islamic world. Medical practice in Islamic regions was generally more advanced than in medieval Europe during the same period. Better hospitals with organized departments, more advanced surgical techniques, extensive pharmacology, continued tradition of medical scholarship. Though still based on humoral theory, more emphasis on clinical observation. Byzantium. The Byzantine Empire preserved much ancient Greek medical knowledge. Direct access to original Greek texts that Western Europe had lost. Continued tradition of hospital medicine. Some advancement beyond ancient practices. Eventually declined as the empire weakened Northern Europe. Scandinavia, Germany, and Eastern Europe had less developed medical infrastructure. Fewer universities and medical schools. More reliance on folk medicine and traditional healers. Gradual adoption of medical practices from Southern Europe. Strong influence of monasteries in providing care. The impact of trade and communication. Medical knowledge and practices spread through. Trade routes. Merchants brought back medicinal substances and knowledge. Universities. Students traveled to study at prestigious schools, then returned home. Warfare. Military surgeons learned from each other. Religious networks. Monasteries shared knowledge across regions. Translation efforts. Medical texts were translated and circulated. Royal courts. Physicians traveled between courts, sharing practices. Despite these connections, regional variations persisted throughout the medieval period, meaning your experience with medieval medicine depended significantly on where you lived. Chapter 30. The transition toward modern medicine. The medieval period didn't end with a sudden revolution in medical practice. Change came gradually, with the late medieval period showing early signs of the transformation that would eventually lead to modern medicine. The printing press, mid-15th century. Gutenberg's invention revolutionized medical knowledge distribution. Before printing, medical texts had to be hand-copied, making them expensive and rare. Errors accumulated with each copying. Knowledge spread slowly. Only wealthy institutions could afford extensive medical libraries. After printing, medical texts became more affordable and widely available. Standardized texts reduced copying errors. Knowledge spread faster. More people could access medical information. The first medical texts printed included Ancient works by Galen and Hippocrates, Arabic medical texts in translation, contemporary medical writings, anatomical illustrations, early challenges to authority. Late medieval period saw the first serious challenges to Galenic medicine. Paracelsus, early 16th century, rejected much of traditional medicine and advocated for chemical/mineral-based treatments. Controversial but influential. Andreas Vesalius, mid-16th century. His detailed anatomical studies based on human dissection revealed numerous errors in Galen's work. His book, De Humani Corporis Fabrica, 1543, marked a turning point in anatomical science. Growing empiricism. Physicians gradually placed more emphasis on direct observation, documented case studies, testing treatments to see what actually worked, questioning ancient authorities. This didn't mean abandoning humoral theory immediately. That would take much longer, but it represented a shift toward evidence-based thinking. Improved surgical techniques. Late medieval and early Renaissance surgeons developed better instruments, more refined procedures, improved understanding of anatomy, better wound treatment, though still no understanding of germs. Military surgery particularly advanced as wars provided unfortunate opportunities for practice. The limits of progress. Despite these developments, several crucial breakthroughs wouldn't come until much later. Germ theory, not discovered until the 19th century. Pasteur, Koch. Anesthesia, first successful public demonstration in 1846. Antiseptic surgery, developed by Lister in the 1860s. Antibiotics, Fleming discovered penicillin in 1928. So while the late medieval period showed signs of progress, medicine would remain dangerous and largely ineffective for centuries more. What didn't change? Even as some aspects of medicine evolved, many practices persisted. Bloodletting continued well into the 19th century. Humoral theory remained influential for centuries. Dangerous and ineffective treatments remained common. Medical care was still inaccessible for many poor people. Superstition and medicine remained intertwined. Extended, Part 8. The bizarre, the brutal, and the barely believable, Chapter 31. Thus, most insane medieval medical beliefs. We've covered a lot of ground, but there are some medieval medical beliefs so bonkers they deserve their own spotlight. These are the theories that make you wonder how anyone took medicine seriously. The doctrine of signatures. This was the belief that God had marked plants with signs indicating what they were good for treating. The logic went like this. A plant that looks like a body part must be intended to treat that body part. Examples: walnuts look like little brains, so obviously they're good for headaches and mental disorders. They're not, but medieval doctors prescribed them anyway. Lungwort. This plant has leaves with spots that supposedly resemble lung tissue, therefore it must treat lung diseases. Spoiler, it doesn't particularly. Liverwort. Has lobed leaves resembling a liver. Must be good for liver problems. Again, not really. Eyebright. Has flowers with markings that kind of look like bloodshot. Eyes. Perfect for treating eye conditions, except it isn't especially effective. Saxifrage. Grows in rocky areas and breaks through rocks. Therefore, it must break up kidney stones. The logic is completely disconnected from reality, but it made sense to medieval minds. This wasn't just folk belief. Learned physicians took the doctrine of signatures seriously. They wrote treatises about it. They prescribed treatments based on it. They genuinely believed God had created a visual instruction manual for medicine. The wild thing? Occasionally it worked, but only by coincidence. Some plants that looked like certain organs did have compounds that affected those organs, but the visual similarity had nothing to do with it. Medieval doctors stumbled into correct treatments while following completely wrong reasoning. Weapon salve. Here's a belief that defies all logic. If you got wounded by a weapon, you should treat the weapon, not the wound. The theory was that there was a sympathetic connection between the weapon and the wound it caused. So if you applied healing ointment to the sword that cut you, the wound would heal faster. Physicians would have elaborate recipes for weapon salve containing moss from a dead man's skull, always with the dead man's skull, human fat, mummy powder, various herbs, blood of various animals. You'd apply this to the weapon and keep it in a safe place. Meanwhile, the actual wound was just cleaned and bandaged simply. The absolute comedy of this is that it occasionally seemed to work, but only because leaving the wound alone and keeping it clean was better than applying the toxic garbage medieval doctors usually put on wounds. By treating the weapon instead of the wound, they accidentally avoided making the wound worse. Transference theory. Medieval medicine believed diseases could be transferred from humans to animals, plants, or objects through various rituals. For warts, rub the wart with a piece of meat, then bury the meat. As the meat decays, the wart will disappear. Warts sometimes do disappear on their own, so this worked, often enough to perpetuate the belief. For fever, transfer the fever to a tree by hugging it and asking the tree to take your illness. Then nail something to the tree to seal the transfer. For toothache, bite a piece of wood from a tree that's been struck by lightning, then hammer the wood into the tree. Your toothache supposedly goes into the tree. For various illnesses, some doctors recommended transferring disease to a live animal. You'd hold the animal close to the affected body part, perform certain rituals, then release or kill the animal. Your disease would supposedly go with it. This is sympathetic magic dressed up as medicine, but medieval doctors didn't always distinguish between the two. The moon's influence on everything. Medieval medicine was obsessed with lunar cycles affecting health. Surgery timing. Surgeons consulted lunar calendars before operating. Certain phases of the moon were considered favorable, others disastrous. Operating during the wrong moon phase supposedly increased bleeding, infection risk, and complications. Bloodletting schedules. The best time to let blood depended on the moon's phase and position in the zodiac. There were elaborate charts showing which days were good for bloodletting and which were forbidden. Pregnancy and birth. The moon's phase at conception supposedly influenced the baby's sex, temperament, and health. The phase during birth affected the child's future. Menstruation. Women's cycles were thought to be governed by the moon. There's actually a correlation in cycle length, but medieval doctors took it way further than reality. Mental health. The full moon was believed to trigger madness, hence lunacy from lunar. This belief persists today despite no scientific evidence. Medication timing. Some medicines were supposed to be taken only during certain lunar phases to be effective. Modern medicine has found no evidence that the moon's phases affect health, surgery outcomes, or anything else medical, beyond affecting people who believe they're affected. But medieval doctors planned entire treatment schedules around it. Chapter 32. The role of saints and relics in medical treatment. Medieval medicine existed in a deeply religious context, and the line between medicine and religion was often blurry to non-existent. Patron saints of diseases. Different saints were associated with different ailments, and praying to the right saint was considered crucial for healing. Saint Sebastian, protection against plague. His martyrdom, being shot with arrows, was symbolically connected to plague's arrows. Saint Roch, also plague, particularly after he survived it himself. Saint Apollonia, toothaches and dental problems. She was martyred by having her teeth pulled out. Saint Lucy, eye diseases. She's often depicted holding her eyes on a plate. The legends vary on why. Saint Blaise, throat ailments. He supposedly saved a boy choking on a fishbone. Saint Anthony, ergotism. Saint Anthony's fire. Though he had nothing to do with ergotism historically, he became associated with it. Saint Vitus, epilepsy and nervous disorders. People with seizures would invoke his name. Saint Fiacre, hemorrhoids. Yes, there was a patron saint of hemorrhoids. Medieval saints covered all bases. The treatment protocol. Seeking saintly intervention for illness followed patterns. Prayer, direct petition to the saint for healing. Pilgrimage, traveling to a shrine, or church housing the saint's relics. The journey itself was part of the healing process. Votive offerings, leaving offerings at the shrine. Wax body parts representing the afflicted area, coins, valuable objects. Touching relics, physical contact with bones, clothing, or objects. Associated with the saint was believed to transfer healing power. Drinking holy water. Water that had washed over a saint's relics or blessed by proximity to them. The economics of relics. Churches with famous healing relics became wealthy from pilgrims, offering donations, buying badges and souvenirs, paying for accommodation and food. Making votive offerings, this created incentive for fraud. Churches would discover new relics, claim miracles associated with them, and attract pilgrims and their money. Some relics were clearly fake. Enough pieces of the true cross existed to build a forest. Multiple churches claimed to have John the Baptist's head. So many saints' bones existed that some saints would have needed multiple skeletons. Medical pilgrimages. Sick people undertook pilgrimages hoping for miraculous cures. Canterbury, England. St. Thomas Becket's shrine attracted pilgrims with various ailments. Santiago de Compostela, Spain. The shrine of St. James drew pilgrims from across Europe. Lourdes, France. Though the famous apparitions occurred after the medieval period, the practice of healing pilgrimage sites was well established. Did it work? From a modern perspective, no. Relics don't have healing power, but the pilgrimage itself might have helped some people. Exercise from the journey improved health. Change of environment and routine could reduce stress. Time away from unhealthy living conditions. Placebo effect from strong belief. Natural recovery timed coincidentally with the pilgrimage. Plus, people who died during or after pilgrimage weren't counted as failures. Their death was God's will. Only the survivors who felt better were counted as miracles, creating severe selection bias. The Church's position. The Catholic Church had a complicated relationship with medical miracles. Official stance. Miracles were possible through God's power and saintly intercession. Genuine miraculous healings could occur. Skepticism. Church authorities knew fraud was rampant and investigated claimed miracles. Many were debunked. Pragmatism. Even if some relics were fake, if they strengthened faith and brought people to church, was that so bad? Competition with medicine. Some clergy argued that seeking medical treatment showed lack of faith in God's healing power. Physicians pushed back, arguing God worked through natural means, including medicine. Most people hedged their bets, pray to saints, and see the doctor. Cover all possible sources of healing. Chapter 33. Bizarre surgical procedures you won't believe were real. We've covered some surgical horrors, but there are specific procedures so strange they deserve special mention. Lithotomy, cutting for stone. Bladder stones were common in the Middle Ages. Diet and water quality contributed. These stones caused agonizing pain, difficulty urinating, and could be fatal if they completely blocked the urinary tract. The procedure. The surgeon would 1. Position the patient on their back with legs raised and spread. 2. Insert fingers into the rectum to locate and hold the stone in place. 3. Make an incision in the perineum, the area between the genitals and anus. 4. Cut into the bladder. 5. Extract the stone with specialized forceps. 6. Hope the patient didn't bleed to death or die of infection. Remember, no anesthesia, no antibiotics, no understanding of sterile technique. The survival rate may be 50-50 if the surgeon was skilled. Many patients died from shock during the procedure, blood loss, infection afterward, damage to surrounding structures, but the alternative, living with an obstructing bladder stone, was also potentially fatal, so desperate patients took the risk. Specialists. Some surgeons specialized in lithotomy, traveling from town to town offering their services. The Colop family in France were famous lithotomists for generations. These specialists got fast. The quicker the procedure, the better the patient's chance of survival. Famous lithotomists could extract a stone in under a minute. Couching for cataracts. Expanded. We mentioned this earlier, but the details are worth exploring. The setup. The patient would be seated or lying down. An assistant would hold their head absolutely still. Any movement could be catastrophic. The procedure 1. The surgeon takes a needle, sometimes a specialized couching needle, sometimes just a regular large needle too. Inserts it into the white of the eye from the side 3, pushes it through until it reaches the lens 4, uses the needle to dislodge the clouded lens, pushing it down and back, out of the line of sight 5, removes the needle 6, covers the eye, and instructs the patient not to move it for days. The experience. Imagine feeling a needle penetrate your eyeball, feeling it push against your lens, feeling the lens move inside your eye, all while trying desperately not to move or flinch, because movement could blind you permanently. The outcomes. Best case, the patient could see again, though blurrily, since they no longer had a lens to focus light. Everything was out of focus, but they could perceive light, shapes, and motion. After a lifetime of blindness from cataracts, this seemed miraculous. Worst case, the surgeon went too deep and damaged the retina, causing permanent blindness, or infection set in, destroying the eye. Or the lens shifted back into the line of sight, requiring a repeat procedure. Despite the risks, couching remained the standard cataract treatment for centuries. It was one of the few surgical procedures where medieval surgeons could legitimately restore lost function. Herniotomy. Hernia repair. Hernias, where internal organs push through weakened muscle walls, were common, especially among men who did heavy labor. The medieval approach. For small hernias, they'd try trusses, supportive garments that held the hernia in place. But for large or strangulated hernias, where blood supply is cut off, surgery was necessary. The procedure: 1. Cut open the area over the hernia. 2. Push the protruding organ back inside. 3. Attempt to close the muscle wall defect, usually by cauterizing the edges to create scar tissue, sewing the muscle together, sometimes removing part of the testicular cord in men, often causing infertility. 4. Close the skin incision. The risks: damage to intestines or other organs, infection, recurrence of the hernia. In men, damage to reproductive organs, death from postoperative complications. Some surgeons became quite skilled at hernia repair, but many patients died or ended up with worse problems than before. Arrow extraction. When removing the projectile is half the battle. Battle surgeons faced a specific challenge: removing arrows from wounded soldiers without causing more damage. The problem: arrows had barbed heads that would tear massive wounds if pulled straight out, but pushing them through the body caused even more trauma. The solutions: arrow spoons/extractors, specialized instruments that could be inserted along the arrow shaft, open to grip the arrowhead, then withdrawn, pulling the arrow out backwards without the barbs catching. The cutting method: cut the skin on the exit side, push the arrow through, cut off the arrowhead, then pull the shaft back out. The surgeon's fingers: experienced surgeons might enlarge the entry wound and use their fingers to feel for the arrowhead, manipulating it to withdraw at an angle that minimized barb damage. Special cases: barbed arrows deep in muscle. Sometimes surgeons would make an incision to directly access the arrowhead, remove it surgically, then close the wound. Arrows in bone: these might require removing part of the bone to extract the arrowhead. Survival rates for these were particularly low. Arrows in the torso: often fatal regardless of treatment. If the arrow had penetrated vital organs, extraction was futile. Surgeons might leave the arrow in place and treat the patient for inevitable infection, knowing death was likely. The brutal reality: many soldiers died not from the initial arrow wound, but from shock during extraction, bleeding after extraction, infection in the days following, damage to blood vessels or organs during extraction attempts. Military surgeons developed their skills through terrible practice. After major battles, they'd extract arrows from dozens of wounded soldiers, learning what worked through trial and error, with dead soldiers as the markers of failed techniques. Chapter 34. When medieval medicine accidentally worked. Let's give credit where it's due. Sometimes medieval medicine actually helped people, even if doctors didn't understand why. Willow bark and pain relief. Medieval doctors prescribed willow bark for pain and fever. This actually worked because willow bark contains salicin, which the body converts to salicylic acid, essentially natural aspirin. They didn't know about salicin or how it worked. They prescribed it based on traditional use and humoral theory, but patients got genuine pain relief. Moldy bread on wounds. Some medieval healers applied moldy bread or cheese to infected wounds. This sounds insane, but some molds produce antibacterial substances. They were accidentally using proto-antibiotics centuries before. Fleming discovered penicillin. Honey on wounds. Honey has genuine antibacterial properties and promotes healing. Medieval doctors used it extensively on wounds and burns. Modern medicine has rediscovered medical-grade honey as a wound treatment. Maggot therapy. Some battlefield surgeons noticed that wounds infested with maggots healed better than other wounds. They didn't understand why. Maggots eat dead tissue while leaving healthy tissue alone, cleaning the wound, but they occasionally deliberately introduced maggots to wounds. Modern medicine has brought back medical maggot therapy for certain types of wounds. Digitalis for heart conditions. Extracts from foxglove, digitalis, were used for dropsy, what we now call congestive heart failure. This actually works. Digitalis compounds strengthen heart contractions and are still used in modern medicine. Medieval doctors stumbled onto a genuine treatment through trial and error and traditional knowledge. Quarantine, the practice of isolating sick people and requiring ships to wait 40 days before unloading cargo. Quarantine genuinely slowed disease spread. Medieval authorities didn't understand germs or how disease transmitted, but they observed that isolation worked and institutionalized it. Some surgical techniques, despite all the horrors, some medieval surgical techniques were sound. Suturing wounds closed, promoted healing. Splinting broken bones allowed them to heal straight. Traction on broken limbs to realign bones was correct treatment. Draining abscesses could prevent the infection from spreading. Traditional herbal knowledge. Many traditional remedies passed down through generations actually worked. Peppermint for digestive issues. Genuinely helps. Chamomile for sleep. Mild sedative effect. Garlic for various ailments. Has antibacterial properties. Ginger for nausea. Actually effective. The accumulated knowledge of what plants helped with what symptoms was valuable, even if the theoretical understanding was wrong. The placebo effect. Never underestimate the power of belief. When a trusted healer gave you medicine with confidence and you believed it would work, sometimes you felt better even if the medicine did nothing. The ritual of treatment, the examination, the diagnosis, the prescription, the confidence of the healer, had psychological benefits that could translate into real improvement for some conditions, particularly pain and stress-related issues. Natural recovery. Most illnesses are self-limiting. Your immune system fights them off with or without medical intervention. Medieval doctors benefited from this constantly. They'd treat someone with bloodletting and herbs. The patient's immune system would cure the infection, and the doctor would claim credit. The fact that humans survived medieval medicine in large numbers is mostly testament to the body's resilience, not the effectiveness of treatments. But occasionally, the treatments actually helped. Final extended conclusion. So here we are, at the end of our journey through medieval medicine. We've seen bloodletting, trepanation, urine tasting, weapon salve, and more bizarre beliefs and brutal treatments than you can shake a flea mat. What's the takeaway from all this? First, medieval medicine was a product of its time. Doctors were working with ancient texts, religious beliefs, incomplete anatomical knowledge, and no understanding of biology at the cellular level. They couldn't see germs. They didn't understand chemical processes in the body. They had no way to test theories scientifically. Given these constraints, they built an elaborate explanatory system, humoral theory, that made internal sense, even though it was completely wrong. They developed treatments based on this theory and on trial and error. Some treatments helped, many did nothing. Some made things worse. Second, medical progress is slow and uneven. It took centuries to move from humoral theory to understanding that germs cause disease. It took even longer to develop effective treatments. Each generation built on the knowledge and mistakes of previous generations. The Renaissance brought better anatomy through dissection. The scientific revolution brought experimental methods. The 19th century brought germ theory and anesthesia. The 20th century brought antibiotics and modern surgery. We stand on the shoulders of giants, and also on the shoulders of medieval doctors who bled patients to death while genuinely trying to help them. Third, compassion and care matter, even when treatments don't work. Medieval hospitals provided food, shelter, and comfort to the sick poor. Midwives attended women in childbirth. Wise women prepared remedies for their neighbors. Monks and nuns cared for plague victims. These people couldn't cure most diseases, but they provided human connection and comfort in suffering. That matters. Fourth, we should be humble about current medical knowledge. We mock medieval doctors for their ignorance, but we're also ignorant. We just don't know what we don't know yet. Future generations will probably look back at some of our current treatments with horror. They'll wonder how we could have been so primitive, and they'll be right, just as we're right about medieval medicine. Medical knowledge is always incomplete. We're always doing our best with what we know, making educated guesses, sometimes getting it wrong. Finally, be grateful. Genuinely grateful. Next time you have a headache, take an aspirin and be grateful you don't need bloodletting. Next time you need surgery, appreciate anesthesia and antiseptic technique. Next time you take antibiotics, remember that a simple infection could have killed you a century ago. We live in an era of medical miracles that medieval doctors couldn't have imagined. We can transplant organs, cure cancers, replace joints, restore sight, extend life. We're not perfect. Medicine still makes mistakes, still has much to learn, still can't cure everything. But we've come so far from the days when the best medical treatment was examining your pee and deciding which humor needed balancing. Medieval medicine was horrifying, fascinating, occasionally effective, usually useless, and always conducted by people who genuinely believed they were helping. We've learned from their mistakes and built on their few successes. And someday, future doctors will learn from our mistakes and build on our successes. That's how progress works. Slowly, painfully, with many detours and dead ends, but always moving forward. So here's to medieval doctors who tried their best with what they knew, even when what they knew was almost entirely wrong. And here's to modern medicine, which is infinitely better, even though it too is imperfect and incomplete. Now, if you'll excuse me, all this talk about medieval medical procedures has given me a headache. I'm going to take some willow bark, aspirin, and be grateful I live in a time when headache treatment doesn't involve drilling holes in my skull. Thanks for sticking with this journey through the bloody, bizarre world of medieval medicine. Stay healthy, appreciate modern healthcare, and maybe say a little thanks that you weren't born in 1347, because trust me, you would not have enjoyed the medical care